The justice system for those who want to take on insurance companies or big business has become difficult in Texas. Unfair tort reform laws have closed the courthouse doors to the most vulnerable in our society, including the elderly and children. You need competent legal representation when it comes to serious accidents and if you have suffered harm from a drug product or medical device. Joe Flores can help. Backed by 20 years as a medical professional and as a trial lawyer, Joe Flores can evaluate your claim. The law offices of Joe Flores, equal justice for all.
And welcome back from a brief break. We're visiting with Catholic Charities, but we want to take a break to thank our sponsors, Vasquez Flores Home Health, 881-9922. Backed by more than 20 years experience as an RN, Priscilla Vasquez can determine whether your loved one can stay at the house with dignity, not try to avoid a nursing home. Nothing wrong with it if you need that extended care, but if you want to remain in the home, contact Priscilla Vasquez. See if you qualify for a provider, 881-9922. And let's not forget another one of our great sponsors, Janet Montaigne with River City Hospice, 882-5900. That's 882-5900. That's care, dignity, and love. It's gotta be hospice. That's 882-5900. And I want to thank both our sponsors, Vasquez Flores Home Health, 881-9922, and River City Hospice, 882-5900. With me back is Jacqueline Siller, also from Catholic Charities, but also with University of Texas Outreach. So
yes.
Welcome.
Hi, thank you so much for having me.
Well, I know that you all have a facility there on 1125 South Port, and it's the Healthy Living Center, and it's part of the extension of the wonderful things we were just talking about with Gigi Dean on the Catholic Charities. Tell us about this very, very important this facility that's helping people.
We're actually a satellite office of Catholic Charities of Corpus Christi. We opened our doors at the Healthy Living Center just in January of this year.
Congratulations.
So it's a fairly new facility. The program started for diabetes prevention and control back in around November of 2010. So even the program has not been around that long. We are open to the public. All of our services are free. We teach everything from exercise to nutrition, cooking classes, demonstrations. We have a formal diabetes curriculum that we do with clients, and you don't have to be a diabetic. We really stress prevention because we know diabetes is preventable.
Yes.
Yes, and so we work with diabetics on a really like a case management type basis to try to get them to control their diabetes, take their medications, eat healthy, exercise more. The Healthy Living Center provides a place to do that. It's we have exercise classes going on. Tuesday through Friday we've got programming. There's always something going on. You don't have to sign up. You can come in the door and join a class. Make it very easy.
Well, and you know, one of the things that, and I'm bringing this out too, is guys like me, the guys who, you know, try to stay away from the snack store, trying to wrap the chains around the refrigerator. I mean, it's not just us, it's everybody in the Hispanic community. It's exploding. The diabetes and everything else, prevention is the key. And just like Commissioner, formerly Judge Gonzalez on education, he also helps you guys out in many ways. And one of the things is you've got to pay for it up front. If not, people cannot afford a lot of healthcare services. So tell me specifically what you guys are doing there at Healthy Living Centers. There's education, prevention. Now anybody can go, but do you have physicians there, or is it in coordination with Catholic Charities? How does it work? How is it broken down?
We're a department under Catholic Charities, and fairly a new type of concept for Catholic Charities of Corpus Christi and the diocese, because there's a definite health component to this. However, we are community-based, so we're not affiliated directly with a clinic. We don't have physicians on staff. What we do have community health workers. So the promotora model is what we use. The community
the
health
what now?
Promotoras.
Help me out here.
Community health workers.
Oh, okay.
They're lay health professionals, and they're certified by the state of Texas. But they're trained in a way that they are able to get out there and really get to know the families. They usually are from the communities that they serve.
Fantastic.
And so they really build a trust. So in order to treat the family, which is what we do, we usually use a holistic approach. So we're not just treating an illness. We're not just treating, we're not just doing one thing. We're looking at the family, the individual as a whole, and we're helping them to overcome all kinds of barriers. We help them find doctors. We do prescription assistance.
Nice.
All different kinds of things that, going back to the economy and all the services that Catholic Charities provides for everyone, and a lot of our more poor communities, we're able to do that for free. We want to empower people to know that it's just as you can cook at home. And you know, sometimes with the economy the way it is, it's very easy for a family who doesn't have a whole lot of money to think that it's cheaper to buy it on the dollar menu at McDonald's. So you can go get 5 hamburgers for $5. We really teach nutrition classes where we show that you can cook for $1.29 a serving. Sometimes it's 97 cents. So our cooking classes are very specific to being diabetic friendly, healthy for anybody, well-balanced meals, but also affordable, using common ingredients, sometimes substituting traditional favorite recipes, just substituting some ingredients makes it healthy and affordable.
Well, and everybody out there, the number is to contact is 442-2607, correct?
That's our fax number.
That's your fax. Oh, so it's
2224.
2224. So say the number again.
It's area code 361-442-2224.
Okay, and that number is going to appear in front of your screen. Now, there's also a website, or is there an email that people can contact you at?
Our website is open. Yes, we have a website. It would be www.utco.org.
Okay, and we'll put all that up on the screen. Diamond Day will take care of that. And he's also very involved in helping with people who need things, the homeless and everybody else. What population are you seeing showing up there? Because I know that you all are a very well-hidden secret that I want to put the light on and really help people out there. Our 100,000 subscribers to Time Warner that flip us between ABC and NBC and watch us all the time. So, I mean, what population are you all reaching? What's the typical patient or the learner that comes in there?
Well, just like poverty and homelessness, diabetes certainly does not discriminate. So we've been so surprised at just the diverse population that's come through our doors. Everybody from people that are very educated that have diabetes, that are just still making all the wrong choices, down to people that just can't afford or don't know where to go. The grant was originally given by the state of Texas, the Department of State Health Services, and designated to Nueces County. However, we help anybody. The diocese covers 12 counties, as would we. Our Healthy Living Center is open to the public. We do outreach all over the county, and even with the homeless. We have a diabetic screening program that we do over at the Mother Teresa shelter. So we really had to tackle all populations. What we're seeing, again, is that people have an awareness about diabetes. Everybody knows somebody in their family or a friend, and the awareness is there now. I think people around our area are ready for a change, and that's where our goals are to help people make those lifestyle changes. As I said, our original grant was through the state. We've also been so blessed to have a very generous grant by the Commissioner's Court, Commissioner Gonzalez and his colleagues, so that we can provide some healthy cooking classes out in the more rural areas. So we're going to pick some specific places and offer some ongoing session series types of classes where families can come together, learn how to cook, have a meal together, experience that coming to the table type of feeling that we've gotten away from. So we've just been really blessed. Well,
and you're listening to Jacqueline Siller there, and you can contact her at 442-2224, extension 17. I also encourage people, if people want to give, write a check. As I asked Rose Peasy from CC Ministries, when somebody writes a $50 check, and you know they're down on one knee economically, in the last couple of minutes left, where does the money go if they want to help out and write checks?
To donate, the easiest thing would be to send it directly to our main office, which would be the Catholic Charities.
Yes.
As Ms. Dean said, there's our website, www.catholiccharities-cc.org or www.diocesofcc.org.
And they're at 1322 Comanche Street,
Yes.
also here in Corpus Christi.
Yes.
If somebody wants to mail in a check, snail mail it. And when somebody gives $50 and it goes to yours, how is that money distributed, or what is it used for?
Our services, everything that we do is direct service. The community health workers, we provide backpack food for homeless. It provides the food that we use for our cooking demonstrations. We've been very proud to keep this very community-based and be able to use all the money that's been given to us for direct services. This year, the first fiscal year this program was in place, we served over 6,000 people.
Well, that's fantastic. We've got a minute left. Closing arguments. Why do people need to get involved and get behind healthy living centers?
Because it's a lifestyle change. It's what we have to do. In diabetes alone, conservatively, over 2,000 people each year are diagnosed in this area with diabetes. It's an epidemic, and the only way we can prevent it is to make some changes in the way we eat, the amount of exercise we get, and just our awareness.
All right, you got me sold. The guilt. All right,
Come on
anyway,
in.
all right, man, we're going to come down too. And we're going to have the commissioner come on and wrap it all up and tell us what's going on out there in his area, in the rural areas that you are now reaching with more funding through his help and the wonderful commissioners and the county judge that are working hard for the community. So we're going to bring him on. But I want to thank you for coming by. And everybody contact her at 442-2224, extension 17. That's Jacqueline Siller, to ask if you have any more questions or you want to stop by. And their facility is located at 1125 Southport Avenue. We're going to take a brief break, and we're coming back with the commissioner, and we're going to talk about what's going on in the outlying areas. But thank you so much for coming by. I hope you come by and visit again.
I will.
All righty. Well, thank you and Gigi very much.
Thank you.
Have you been arrested or are potentially facing criminal charges? You need a trial attorney who is well-versed in the courtroom. Joe Flores has handled hundreds of criminal cases and many of them to trial. Joe Flores can provide you with competent representation to protect your constitutional rights in state and federal court. Joe Flores can help if you have been arrested or facing criminal charges. The law offices of Joe Flores. Equal justice for all.
Attention! Was your child born with a birth defect? Some prescription drugs taken during pregnancy have been linked to birth defects, including antidepressants Paxil, Zoloft, Prozac, Wellbutrin, and Lexapro. Also, prescription-strength pain relievers containing codeine, such as Vicodin and Tylenol 3 with codeine. If you or your loved ones took any of these prescription drugs while pregnant and your child was born with a birth defect, call nurse practitioner and attorney Joe Flores at 887-8670. That's 887-8670. Call today.